Slap tears or labral tears in the shoulder are some of the most commonly misdiagnosed conditions of the shoulder. It's often confused with bursitis, rotator cuff injuries, or so forth.
Before we get into it, for anyone watching for the first time, can you introduce yourself?
Of course. I'm Dr. Leon Popovitz. I'm a board-certified orthopedic surgeon and one of the co-founders of New York Bone and Joint Specialists. My practice is exclusively in the treatment of the shoulder, the knee, and sports medicine. My practice philosophy is that preservation is the key to longevity, meaning that the focus is on preserving your tissues and not rushing into surgery.
What is a slap tear, and why does it get missed so often?
A slap tear stands for superior labrum anterior posterior. The labrum is a cushion of cartilage between the ball and socket of the shoulder joint. So if we look at this model here, here's the humerus bone, that's the shoulder bone, and then if you open it up and look inside, there's the socket. Inside the socket, there's this cushion of cartilage that wraps around the rim of the socket bone, which is called the glenoid. This is deep inside the joint, and very often standard MRIs or even ultrasounds will not be able to catch or find these tears, and they often go misdiagnosed.
What is it about the anatomy that makes these tears hard to see on standard imaging?
Again, it's so deep inside the joint, and you have other structures that are essentially surrounding it. Again, attaches socket bone. The biceps muscles that we have in front of our arm, there's a big muscular structure here, and then it narrows and goes up into our shoulder. So it'll go up this groove here and then go inside the shoulder and attaches on top of the labrum. So there's a lot of layers here. It goes beyond the muscle, so it's very commonly not fully noticed or diagnosed. And often a lot of practitioners presume shoulder is rotator cuff, shoulder is rotator cuff. That's not a sophisticated and experienced way of practicing. You want to make sure that you're able to determine the symptoms and order the right images so you can make the right diagnosis.
How often do patients come to you having already seen multiple physicians who missed it?
Very often. Very often, a lot of people will treat the patient with the presumption that it's just simple bursitis, even give them cortisone injections. Young people getting cortisone injections, it's typically right away a red flag. Sometimes they'll get an ultrasound, which is not the ideal test for the labrum, very difficult to be able to see deep inside the joint with a standard ultrasound. Sometimes they get a plain MRI, standard MRI, which even still may not fully find the tear. And that's why very often an MRI arthrogram is the appropriate test. And that's where a little bit of contrast dye is injected into the joint to make it brighter and much more visible right where the labrum exists. And that's where we can determine if the labrum is torn or not.
Is there a test in the office that raises your suspicion before imaging?
Yes, on physical exam, there's a test called the O'Brien test that we do, and if it's positive, it's very often indicative of a tear. And O'Brien test is when we bring the patient's arm across their body with their thumb pointing down towards the floor. And we'll ask them to raise the arm against resistance. And if that causes pain in the joint itself, that usually indicates there's something pathological, something going on in the joint. Very often young athletic people will have a tear causing that pain.
Who typically tears their shoulder labrum?
It's very commonly or most commonly in young athletic people. So throwers, overhead athletes are very, very commonly affected. Repetitive weight lifters, people who are doing a lot of lifting, particularly overhead, may develop a tear. It could also occur from a fall on an outstretched arm or direct impact, such as a tackle in football.
Can a slap tear happen from a single incident, or does it develop over time?
Can a slap tear occur from a single entity? Yes, it can happen from a direct trauma. It can happen from a fall on an outstretched arm. But very, very often it's incremental, it's gradual. Those pitchers, for example, or tennis players with strong serves, that repetitive overhead grinding, eventually kind of grinds and tears that piece of cartilage. So yes, it could happen from a one-time incident, but more often than not, it's a gradual progression.
How young do you see this injury? Is it purely an athletic problem, or do you see it in older patients?
No, it can happen in older patients, but more often than not, the condition is treated amongst young overhead athletes or laborers, weightlifters. It can happen in older people because as time goes on, the constant grinding of life eventually may tear through that cushion of cartilage. Also, as we get older, the tissue is not as elastic or pliable and becomes a little bit more drier and more susceptible to tearing.
How does a patient with a slap tear describe their symptoms versus someone with a rotator cuff problem?
So when a young patient comes into the office and says, hey, I'm a pitcher, I'm a lacrosse player or a tennis player, an overhead athlete that uses that arm, they often will give the history of a painful click in their shoulder or clunking in their shoulder, or even sometimes it gets caught. And that's that piece that's moving around inside that joint. Typically, they'll also mention that they don't feel the same strength as they had before. So if it's a pitcher, they may lose 5-10 miles per hour on their fastball. If it's a weightlifter, they don't have that same kind of strength when they're lifting. That usually is a sign that intra-articular, inside the joint, something's occurred, and more often than not, it's the labrum that's the cause.
Is there a specific symptom that makes you think slap over rotator cuff?
So again, it's the overhead athletes, the painful clicking, and mechanical symptoms. So the rotator cuff are these tendons around the bone itself that moves the arm in different directions, while the labrum is this cushion stabilizer in between the bones. If that cushion tears inside the bone, then it can create what's called mechanical symptoms, which is feeling of looseness or catching or snapping or popping or painful clicking. While the rotator cuff really doesn't do that, it more often will give you pain on the outside of your shoulder as opposed to inside the joint itself, and it'll give you pain with overhead activities. But the labrum tear, it may give you pain with overhead activities, but it's more often than not lifting overhead things, not just simply raising your arm.
Can you have both a slap tear and a rotator cuff problem simultaneously?
You can, and that's more commonly occurring in older patients, but it can occur in younger patients. In older patients, it might be more of a degenerative wearing away of the portion of the labrum, the cartilage, while at the same time people develop little bone spurs in and around the rotator cuff. So when the arm moves, it constantly grinds. So you may tear some of the rotator cuff, but that grinding may also tear some of the labrum itself. As you get older, the labrum becomes less of a concern and the rotator cuff becomes more of the concern. The other circumstance is that sometimes people will develop instability of the joint when they have a labral tear, and that constant instability makes the humeral head move around and bang up against the undersurface of the rotator cuff. And that can cause some partial tearing of the rotator cuff. But the initial culprit is the instability caused by the labral tearing.
You said a regular MRI can miss this. Yeah. What should a patient do if they suspect a labrum tear and the MRI came back normal?
If the doctor suspects a labral tear and the standard MRI came back normal, I would get an MRI arthrogram. And that involves a slight injection into the joint itself, injecting some gadolinium, which is a dye, and that allows everything to be much brighter and allow us to focus directly on the joint itself.
Should every patient with a suspected slap tear get an arthrogram, or only certain cases?
So typically we don't get overly nervous if someone in their late 50s or 60s has a degenerative labral tear. But someone who's young and active and we're suspecting a labral tear, a MRI arthrogram off the bat would save a lot of time and allow us a more accurate diagnosis. Now, if you have access to a high-powered new magnet MRI machine, high-field MRI machine, Some of the newer ones are very, very good and do display the labrum very, very well. So if that's the case, if you have a high field MRI available, you can certainly try that first. But if you don't, I would go straight to the MRI arthrogram.
Is there a risk to an MRI arthrogram that patients should know about?
Extremely uncommon. If you have a history of kidney disease, then you need to ask your nephrologist if it's okay for you to have the dye. Other circumstances, very, very rare. I think it's 1 in a couple of thousand. There is a chance of infection. But again, it's extremely uncommon. So that we can help more people and reach more people, please be sure to like our video and subscribe to this channel. Thank you so much.